Right, good evening, everyone. We should literally be starting now. And here we are with the slides and the presentation. It's all up. And essentially today, what I'd like to focus on is actually going to be about joints itself, because we're actually going to start to really understand a bit about joints and how they work, and actually start to really understand rather than memorizing in numeric fashion for our musculoskeletal system itself. So for those of you who don't know me, my name is Fahim. I'm a pharmacy prescriber, contractor, and the founder of MedLearn. And today we are going to start to delve into part 3 of the webinar series, and we're looking at joints itself. So without any delays, essentially that's our vision. We want to upskill pharmacists, nurses, doctors, all sort of healthcare professionals to be the best versions of themselves. And together we can build a better world. So joints. So without wasting and getting into too much, let's actually start to give a bit of an overview of what joints are itself. So most of you, when you see or hear the term joints, you're probably thinking about those joints that allow movement. So for example, my shoulder, or maybe my hip, or my wrist, which is correct. So essentially, what are joints? You can think of joints as a joint. I don't want to use the word joint itself. So think of joints as a connection, And what are we connecting? In this case, because we're talking about the human body itself, we're talking about bone to bone, possibly, or we're talking about maybe bone to even tooth. So essentially, think of it as a connection. That's all a joint is. It's just a connection. We see joints all the time around us. For example, you'll see a joint maybe in a chair, for example. You'll see a joint in various different other parts that you can find, like, I don't know, between a door, you might see a joint. So all it is just some sort of connection. And we also see the term articulation. And another term you should know is arthrosis, because this arthro, you're going to see that term all the time. So as a minimum, you should understand what is a joint. A joint is essentially a connection. That's all it is. And in this case, it could be between bone and bone, or it could be between bone and tooth. And remember that bones itself are never directly connected. There's always something in between them, because if the bones are connected directly, you can imagine that there's going to be rubbing, there's going to be friction, and that's not going to be good. So joints always, you would have, for example, you'd have, let's say this is a bone. In between, you'd have some other tissue. So we can do like another tissue here. And then you'll have maybe, let's say, another bone here. But we always have some sort of tissue in between. And that's going to be important, that we've got some sort of tissue in between here like this. And that might be connective tissue. And if you're not sure what the term connective tissue is, we're going to discuss it in depth when we talk about histology. But think of it very simply as what the term means, connective. So it's connecting things together. So I've explained to you what a joint is, an articulation. It is something that's causing a connection. Now, we've explained a bit about the function of joints itself. Joints function for movement and also for growth. Believe it or not, joints also have a role in growth, and they can facilitate growth as well. And you're probably not used to this too much, but we're going to be discussing this in a bit more depth as well, about how they can play a role in growth as well. So these are the two functions that you should be aware of. Now, in terms of classification, how do we classify joints? We can classify joints based on the structure or their function. So you can classify joints based on their structure or the function itself. So when we're talking about structure, it's literally we're describing the joint itself. This is where you're actually describing the joint. It's a description, you're describing the joint, you're looking at the joint, you're seeing what kind of joint we have. And there's two major classifications. Essentially, the joints can be classified if they have some sort of, let's say they have some sort of capsule, or the joint can be classified depending on the type of tissue that binds them together. So the joint can be classified depending on the tissue, that how they're bound together, So, and it can be quite, these terms can be very similar, and we will be looking at these in a bit more depth later on. But in terms of a general classification, we've got essentially joints can be classified, for example, here. And we've got one classification here. This is more structural. And what do we see here? As you've got this capsule here. So we've got this capsule. And inside this capsule, you have fluid, as you can see. And surrounding this, you have various accessory structures like ligaments. Here, on the other hand, these joints, you have a different kind of structure here where we don't have like a capsule, but a solid piece of matter or mass that's connecting them. And here as well, you have a solid sort of connection here as well. So as a basics to take away from this really short session is that we have joints. What are joints? Joints are essentially connections. Why do we have connections? We have connections for movement, but also we have connections to facilitate growth. We can classify these connections based on their structure or based on their function. So a functional classification could be something like a joint that's totally immovable, doesn't move at all, and that's known as synarthrosis. You may have a joint that has very, very little movement, like practically close to zero movement, but very little. We call that an amphiarthrosis. You might have a joint that has a lot of movement, and we call that a diarthrosis. You might have one that has a lot of movement, a diarthrosis. That's a functional classification. The one that we'll be spending a lot of time on is more describing the joint itself. How does the joint actually look? How can we differentiate between the joints? And one little example here, I told you that you could have a capsule. So again, you've got a bone, and you've got a bone, and in between you've got a capsule. And we'll just put CAP here. You've got a capsule. You may have another type where essentially the joints or what's joining the joint together, joining the structure is some sort of tissue that's joining them that is directly connected between them, is a direct connection. For example, sutures, and you have the vertebral disc here. And these are different sorts of joints. We have cartilaginous joints and we have fibrous joints, but we are going to be discussing this in a bit more depth for now. So before you go away, think about what I've explained to you. What are joints? Joints are essentially connections. There's different types. We can classify them based on structure, classify them based on function. You should know from this short series that what is a synarthrosis? That is a functional classification of a joint where there is no movement. What is an amphiarthrosis? That is a functional classification of a joint where there is very, very little movement. What is a diarthrosis? That is a functional classification of a joint where there is huge amounts of movement. For example, the shoulder joint. We can also classify them based on description. How does the joint look? This connection between a bone, and in between whatever we have, what does it look like? Is it solid like? Is it got a capsule in between? That's essentially there. That would be a structural classification. Lastly, I want to talk about ligaments. And ligaments are going to be like these accessory structures that are essentially going to help with maybe the function of the joint as well, or help with the actual supporting the joint itself. And these ligaments can be intrinsic, where they're located within the joint itself, or they can be extrinsic, where they're playing a supporting role for the joint itself. Thank you very much for watching. I hope you found this video useful. And tomorrow, we're going to go into this in a bit more depth. Thank you very much for your time. Keep learning, keep educating, focus on understanding rather than focusing on parrot fashion memorization. Thank you.